In health news, there is an upbeat report on diabetes from the CDC. Rise News medical contributor Dr. Aletha Maybank has that story and more. Hey, Aletha, how are you?
Good evening.
I think I said your last name weirdly, Maybank.
That's okay. I'm used to it. It's okay.
All right, new stats on the diabetes rate falling.
This is great news, actually. So the Centers for Disease Control, in their annual survey that they do across the country, over 600,000 people that they survey every single year, have noticed a decline in the number of new cases of diabetes. So now, since 1990, we've really seen diabetes cases doubled. We've seen this in the news, and we know that the obesity epidemic really drives this because it's the greatest risk factor for diabetes. Starting in the year 2008, though, when they're looking at the numbers, from 2008 to 2012, of which they have data for, they have now seen a steady decline every single year, which is pretty significant. And now they feel comfortable reporting it because they wanted to make sure that this was actually real, and now they are seeing an actual decline. So they're seeing a decline in the number of new cases. Now, there still is an increase in the number of people living with diabetes, not as great of an increase, but there still is an increase, and they're really mainly attributing that to people living longer and healthier lives with diabetes. So this is great news, across the board in this particular fight against this epidemic.
Absolutely. I'm just wondering very quickly, is there a commensurate decline in the rate of obesity?
We're starting to know the numbers. We're starting to see the numbers steady out. For childhood obesity, we're definitely starting to see a decline across major cities in this country. But in particular parts of this country, we're starting to see increases. And if we look at Blacks, Latinos, people of low income, we're not seeing those decreases. We're actually seeing increases still at this particular time.
I just wanted to be sure and say that diabetes is still overrepresented in the African American and Hispanic community.
Absolutely.
Okay, let's move on to the next one. And this is something that has been in the news a lot here in New York City. Our former mayor, Mike Bloomberg, tried to limit the size of the soda that's sold in this city. That didn't go over. But now it seems that soda companies are getting on the bandwagon, if you will.
Well, in a sense, I think they had success yesterday. So we know that the Clinton Global Initiative is going on right now in New York City. And they were able to get a commitment from 3 major soda companies, Coca-Cola, beverage companies, Coca-Cola, Pepsi-Cola, as well as Dr. Pepper, and get them to commit to saying that by the year 2025, that they are going to work to ensure that Americans are decreasing the amount of sugary beverages that they consume by 20%. And so they're going to do this by decreasing the portion sizes and making sure they have more diverse offering of that. They're going to produce more low-calorie or no-calorie drinks, and then provide other education. The other power that they have is that, and that people don't realize, is that they really have a lot of ownership on vending machines on almost every single company across this country. Supermarkets, convenience stores, they're the ones who purchase a lot of the freezers and the freezers and the refrigerators, and then they also have a lot of impact over what happens in the schools as well. So they're going to use those vehicles to decrease and really share this message about being committed to decreasing sugary beverage drink.
And just give our viewers an idea of how much sugar we consume in our average soda consumption.
Well, we know that the average, and actually the single greatest contributor to the obesity epidemic is consumption of sugary beverages. Over half of the calories that children consume are from sugary beverages. And we know children as young as 2 years old are consuming a lot of sugary drinks. So it's a major part of the American diet.
Yeah, that's just crazy. Okay, in the last minute of the show, tell us about the new guidelines from the American Academy of Pediatrics about flu vaccination.
Right, so flu season is about to come on us. Flu shots are available. So what the recommendation is, and has been, is that any child 6 months and older and adults should all be vaccinated every single year. What is new this year is that they're actually recommending for children between the ages of 2 to 8 years old to actually get the nasal vaccine. It's called Flu Mist. And the reason is because they're finding that it actually works a little bit better in children, and children tend to also like it a little bit better as well because it's not the shot as well. So the recommendation, that's the change, but really encouraging people to get the vaccination because we know that most children who end up in the NICU or the PICU, it's because they did not get the vaccine, over 90%.
Yeah, and they're accessible everywhere. You can get them. All right, thank you so much, Aletha.
Absolutely.
We'll see you next week. And that's going to do it for us today. Thank you for joining us. I'm Debbie Turner-Bell. See ya tomorrow.